Important disclaimer, I am not a doctor. Consult a licensed healthcare professional before using any performance-enhancing drug, supplement, or protocol. This video is for educational purposes only. Anavar. You've likely heard the name whispered in gym locker rooms, or seen it mentioned in online fitness forums. It's a substance surrounded by a potent mix of incredible claims and serious warnings. It's often touted as a gentle or beginner-friendly anabolic steroid, promising enhanced performance, a chiseled physique, and rapid muscle growth. But what is the reality behind the reputation? What exactly does Anavar, known scientifically as oxandrolone, do to the human body? How does it achieve its sought-after effects, and at what cost? Is it a safe shortcut to your fitness goals, or is it a gamble with potentially irreversible health risks? In this comprehensive guide, we will dissect the science, explore the history, hear from experts, and listen to real user experiences to uncover the unvarnished truth about Anavar. We'll separate fact from fiction, providing you with the balanced, evidence-based information you need to understand this powerful compound. Let's find out.
Doctor, before we delve into its use in fitness, it's crucial to understand Anavar's origins. Oxandrolone was first synthesized in 1962 by Searle Laboratories, now part of Pfizer. It wasn't created for bodybuilders. Its purpose was purely medical. It was developed to be a gentle, anabolic agent with very low androgenic properties, designed to help patients suffering from catabolic conditions, that is, conditions that cause the body to waste away. Its primary medical applications were to promote weight gain following surgery or chronic infection, to offset the protein catabolism associated with long-term corticosteroid therapy, and to treat osteoporosis by promoting bone density. Legally, oxandrolone is a Schedule III controlled substance in the United States. This means it has a recognized medical use but also a potential for abuse and dependence. It is only legally available with a doctor's prescription. Any other method of obtaining or distributing it is illicit and carries significant legal consequences. So, the substance many seek on the black market for aesthetic purposes began its life as a therapeutic tool for the severely ill. Doctor, so how does it work? Anavar is a synthetic derivative of dihydrotestosterone, or DHT. It's been structurally modified in two key ways. First, it has an added oxygen atom replacing a carbon in the A ring of its structure, which significantly increases its anabolic activity. Second, it's been C17 alpha alkylated, a modification that allows it to survive oral ingestion and pass through the liver without being destroyed. This is also, as we'll discuss later, what makes it hepatotoxic, or stressful to the liver. Its anabolic to androgenic ratio is a key part of its profile. Anabolic refers to muscle-building processes, while androgenic refers to the development of male characteristics. Testosterone has a baseline ratio of 100:100. Anavar, by contrast, has an anabolic rating estimated to be 322 to 630, while its androgenic rating is only 24. This high anabolic, low androgenic separation is why it's often perceived as milder. It strongly promotes muscle growth with a reduced risk of androgenic side effects like hair loss or acne compared to other steroids. Typical medical doses range from 2.5 to 20 milligrams per day. In the performance enhancement world, however, dosages are often much higher, with men sometimes using 30 to 80 milligrams per day and women typically staying in the 5 to 15 milligram range to minimize risks. Its half-life is relatively short, about 9 hours, which means users often split their daily dose to maintain stable blood levels of the compound.
Fitness expert. From a performance perspective, Anavar's unique properties make it highly versatile. It's not a massive bulking agent like Dianabol or Anadrol. You won't gain 20 pounds of water weight. Its strength lies in promoting high-quality, lean muscle tissue. It works by increasing nitrogen retention in the muscles and enhancing protein synthesis. Think of it as making your body exceptionally efficient at using the protein you consume to build and repair muscle. This leads to noticeable gains in strength, often disproportionate to the weight gained. Athletes in sports requiring power and speed without excess bulk, like sprinters or fighters, find this particularly appealing. However, its most popular application is in cutting cycles. When you're in a caloric deficit to lose body fat, you're at high risk of losing hard-earned muscle mass along with the fat. Anavar acts as a powerful anti-catabolic agent, preserving lean tissue while you diet down. It also has a well-documented effect on reducing thyroid-binding globulin, while increasing thyroxine-binding prealbumin. This results in greater utilization of the T3 hormone, which boosts your metabolic rate and accelerates fat loss. The result is a harder, more defined, and vascular physique, making it a pre-contest favorite for bodybuilders and physique competitors.
Doctor, while Anavar can have some positive effects on body composition, it is absolutely not without significant risks. Let's be very clear. No anabolic steroid is truly safe. The C17 alpha alkylation that makes it orally active also makes it hepatotoxic. While it's considered less liver toxic than many other oral steroids, prolonged use or high doses can, and do, cause elevated liver enzymes, indicating cellular stress and damage. In rare cases, this can lead to severe conditions like peleosis, hepatis, or liver tumors. Its impact on cardiovascular health is perhaps even more concerning. Anavar is notorious for wrecking lipid profiles. It drastically suppresses HDL, the good cholesterol that protects your heart, while simultaneously increasing LDL, the bad cholesterol that contributes to arterial plaque. This combination significantly elevates the risk of atherosclerosis and consequently heart attack and stroke. It can also contribute to high blood pressure and left ventricular hypertrophy, where the heart muscle thickens, making it less efficient. Furthermore, even at low doses, Anavar will suppress your body's natural testosterone production. The degree of suppression varies, but it is inevitable. Your hypothalamic pituitary testicular axis, or HPTA, recognizes the external androgen and signals your testes to stop producing their own. This leads to hormonal imbalances and requires a post-cycle therapy, or PCT protocol, to help restore natural function. Finally, there are psychological effects. While less common than with more androgenic steroids, some users report mood swings, irritability, anxiety, and even aggression, colloquially known as roid rage. Doctor, it's critically important to discuss gender-specific risks. Because of its low androgenic rating, Anavar is one of the few steroids used by female athletes. However, the risk of virilization, the development of male characteristics, is very real. This can include a deepening of the voice, enlargement of the clitoris, body hair growth, and menstrual irregularities. For many women, these side effects, particularly vocal cord changes, can be irreversible even after discontinuing the drug. The risk is dose and duration dependent, which is why female users who do choose to take it stick to very low doses for short periods. For adolescents, the use of any anabolic steroid is exceptionally dangerous. Their endocrine systems are still developing, and introducing external hormones can prematurely fuse the bone growth plates, stunting their final adult height permanently. It can also cause severe, long-lasting disruption to their hormonal development. Under no circumstances should a person who has not finished puberty use a substance like Anavar.
Fitness expert. In the world of performance enhancement, you'll hear about stacking and cycling. Cycling refers to using a steroid for a set period, typically 6 to 8 weeks for Anavar, followed by an off-cycle period to allow the body to recover. Stacking is when you combine multiple compounds together. Anavar is often stacked with a testosterone base, even in cutting cycles, to counteract the testosterone suppression it causes. A common myth is that since Anavar is mild, you don't need a post-cycle therapy or PCT. This is false. A proper PCT, often involving drugs like Clomid or Nolvadex, is crucial to help restart your natural hormone production and avoid a crash characterized by low energy, depression, and loss of gains. Another myth is that it directly burns fat. It doesn't. It preserves muscle and boosts metabolism, which helps you lose fat more efficiently while in a caloric deficit. But the diet and cardio are still doing the heavy lifting.
Person 1. I decided to try Anavar for my last cutting phase. I've been training for over a decade, my diet is dialed in, but I wanted to get to that next level of leanness without losing strength. I ran a conservative 8-week cycle. I've been using Anavar for a few months now, and I've definitely seen an improvement in my muscle definition and strength. The pumps in the gym were incredible, and my strength actually went up even though I was eating in a deficit. I got the lean, dry look I was after, but I was meticulous. I got blood work done before, during, and after. I saw my cholesterol numbers go in the wrong direction, which was scary, and my liver enzymes were elevated. It made me realize this isn't a game, but I do worry about the long-term effects it could have on my body. It gave me the results I wanted, but seeing those health markers shift on paper was a serious reality check.
Person 2. A coach at my old gym suggested Anavar to me, calling it the girl steroid and saying it was perfectly safe. I was curious, so I tried it at a low dose. I tried Anavar once, and within 3 weeks, I experienced some mood swings and aggression, which made me rethink using it again. I was constantly irritable and snapping at people. My anxiety went through the roof. Then my voice started feeling scratchy, and I noticed my jawline looked different, harsher. I panicked and stopped immediately. Thankfully, most of the effects reversed, but it was a terrifying experience. It taught me that there's no such thing as a safe steroid. It's important to weigh the pros and cons before starting any steroid regimen, and not just listen to gym talk. Your body, your health, it's not worth risking for a slightly better physique.
Fitness expert. Before even considering something like Anavar, you have to ask, have you truly maxed out your natural potential? This means years of consistent, intelligent training, a meticulously planned nutrition plan tailored to your goals, and optimizing your recovery with 7 to 9 hours of quality sleep per night. These are the foundations. For most people, this is more than enough to build an incredible physique. There are also legal, evidence-backed supplements that can help. Creatine monohydrate is one of the most studied supplements on Earth and is proven to increase strength and muscle mass. Beta-alanine can improve muscular endurance. A high-quality protein powder ensures you're meeting your daily targets. These won't give you steroid-like results, but they are safe, legal, and effective for giving you a natural edge.
Remember the legal and ethical implications. Possessing Anavar without a valid prescription can lead to fines and even jail time. From an athletic standpoint, it is a banned substance in virtually every single tested sport, from the Olympics down to collegiate and even some amateur leagues. A positive test will result in disqualification, suspension, and the stripping of any titles. The risk to your reputation and athletic career is immense.
Despite the potential risks, many people continue to use Anavar in hopes of achieving their desired results. However, it is crucial to consult with a healthcare professional before starting any steroid regimen to ensure that it is safe for you and that you are aware of the potential risks involved. This isn't just a suggestion, it's a necessity for harm reduction. Regular blood work is non-negotiable. You must monitor your liver enzymes, ALT and AST, your lipid profile, HDL and LDL, and your hormone levels. You should also be regularly checking your blood pressure. If you see dangerous shifts in these markers, or if you experience concerning side effects like severe mood changes, signs of virilization in women, or chest pain, you must stop immediately and seek medical advice.
Now for a quick FAQ lightning round. Question 1. Does Anavar cause hair loss?
Doctor. As a DHT derivative, it can accelerate male pattern baldness in individuals who are genetically predisposed. If you aren't prone to hair loss, it's unlikely to cause it.
Question 2. How quickly do you see results?
Fitness expert. Strength increases can often be felt within the first 2 weeks. Visible changes in muscle hardness and definition typically become noticeable around the 3 to 4 week mark, assuming diet and training are on point.
Question 3. Are the gains from Anavar permanent?
Doctor. No gains from any steroid are truly permanent without continued stimulus. However, Because Anavar builds quality, dry muscle tissue rather than water retention, the gains are considered easier to maintain post-cycle, provided you implement a proper PCT and continue to train hard and eat well. In conclusion, while Anavar can have some benefits for those looking to improve their physique and performance, it is essential to be aware of the potential risks involved. It is a powerful pharmaceutical drug, not a magic pill. Its effects on your liver, your heart, and your hormones are real and must be respected. Always consult with a healthcare professional before even considering any steroid regimen, and listen to your body's signals to ensure that you are using it safely. Your long-term health is infinitely more valuable than short-term aesthetic goals.
The decision to use a substance like Anavar is a serious one with lasting consequences. Our goal today was not to condemn or condone, but to educate. Remember, your health should always come first. Stay informed, be critical of the information you receive, and make smart, evidence-based choices when it comes to enhancing your performance and physique. Thank you for watching The Truth About Anavar. If you found this video informative, please subscribe for more in-depth content, and share this with someone who might benefit from this knowledge. Thanks for watching. Please like and subscribe for more.